New therapies that are developed are aiming at different things. One of the most promising thing is that is anti-adhesion agencies. So they try to prevent adhesion of red cell and white blood cells to the vessel wall. And there are different compounds now tested in different phase 3 studies, and they show to be effective. So these are the drugs that I expect to come to the clinic very soon. Another very spectacular one is that it changes the oxygen affinity and therefore reduces hemolysis. And we know from the organ damage in sickle cell patients that hemolysis is actually driving most of the sickle cell organ damage at older age. So we believe that that drug will have an effect. The study is not on organ damage, but it's simply on whether the hemoglobin levels go up and whether there are less crises, which is of course very important. But I think that more important as an endpoint would be whether you can prevent organ damage in those patients. So these are two drugs that are very hopeful. Well, there are a number of drugs. So one is Rivipansel, which is an P-selectin inhibitor. The other one is Crizanlizumab. This is an antibody against P-selectin as well, which is given to patients to prevent sickle cell crisis. They have to be injected every month with that drug. And there is a drug that's called Heparin, which is one kind of modified heparin, which is also inhibiting P-selectin and other targets, and also is inhibiting the adhesion. So these are three drugs that are in the process of phase 2 and phase 3 trials, and we are very anxious to wait for their results.